Knock, knock. Hello.
Hi.
How are you doing today?
I'm good. How are you?
I'm doing pretty well. I'm doing a little hand hygiene. So today I have a head-to-toe assessment of you scheduled today. But before I begin, can you please tell me your name and your date of birth?
Nadia Godoroja, March 28th, 1995.
Perfect. We have the right patient then. So I'm just going to begin in just a second. Do you have anything you need to do before we begin?
No, I'm good.
Perfect. I'm going to close the blinds after washing my hands for 30 seconds with hand sanitizer. So looking at the patient's head, I see it's normal cephalic. I see the face is oval in feature while talking to the patient. I didn't see unusual spasms of the face while she was talking. Skin color is consistent with patient ethnicity, and the features of the face are bilateral symmetrical. Looking at the patient's hair, I'm looking. I don't see any signs of pediculi behind the ears. I'm palpating. Does any of this hurt? No?
No.
Good. I don't feel any masses. Looking at the hair, I see the hair is blonde. I see it's thin and long. If you could lift your head back up for me. Perfect. I'm looking now at the eyes. I see the eyebrows are bilaterally symmetrical. The hair is evenly distributed. Looking at the eyelids, I see the skin color is consistent with patient ethnicity. And the eyelids, the hair is evenly distributed, and they curve up and out on the top and up and down on the bottom. Looking at the cornea, I see it's clear and translucent. I see the sclera is white. I see the pupils are round, bilaterally symmetrical, and blue in color. I'm now going to assess the patient's field of gaze. So if you could please look at this pin and just follow it through each field, okay? And don't move your head. While doing this, I don't see any signs of nystagmus, and the patient was able to follow the pin light through all 6 fields of gaze. Cranial nerves 3, 4, and 6 are intact. I'm now going to assess the patient's corneal light reflex. Shining light in the eye, I see that eyes reflect the light bilaterally and symmetrically. I'm now going to assess the patient's pupillary response. So I'm going to shine a light into the patient's left eye. I see it constricts briskly to direct light. I'm now going to shine a light into the patient's right eye, and I see that the left eye constricts briskly to indirect light. Now if you could look at that wall for me, and then look at this pin, and as they bring the pin in, I see the pin constricts. While it was dilated from looking away, I see the pupils are equal, round, reactive to light, and accommodation. I'm now going to look at the patient's ears. So I see the outer canthus eye lines up with the pin of the ear. I see this skin color is normal, consistent with patient ethnicity. There's no redness. If you could please tell me if you feel pain. I'm palpating your tragus here.
No.
And when I palpate the mastoid area, do you feel any pain?
No.
And do you feel any pain when I palpate your auricle?
No.
I don't see any redness. Now I'm going to get my otoscope. I'm going to pull up and back on the pin, and I'm going to shine a light in. And I'm looking, I don't see any redness, I don't see any unusual drainage. I see serum is consistent with the patient's ethnicity and coloration, and there's a normal amount. I'm going to move in. I still don't see any drainage. I see the tympanic membrane is flat. I see it's pearly gray in color, and I see the cone of light is at 7 o'clock, which is consistent with the patient's left ear. I don't see any masses in there or any lesions as well, so that's healthy. I'm looking at the patient's nose. I see it's midline with the patient's body. I don't see any redness when I palpate. Does this hurt?
No.
No? Patient reports no pain. If you could lift your head back up for me. I'm now looking inside at the septum. I see the septum is midline with the body. I don't see any perforation. I see the hair is evenly distributed inside, and there's no signs of redness. If you could bring your head back down, just stare at me. I'm looking at the patient's lips. I see the lips are pink, moist. There's no signs of lesions or any masses on them. There's no cracks. If you could please open your mouth for me. Looking inside, I see the tonsils barely. I'd rate that at a 1+. I see the oral mucosa is pink, healthy. The tongue looks healthy and pink as well. I'm going to now assess the patient's cranial nerve 10. So I'm going to put this on the patient's tongue. If you could please say ah for me. When the patient says ah, I see the uvula retracts up and back. Cranial nerve 10 is intact. I'm going to throw that away. I'm now going to assess the patient's range of motion of the tongue. If you could stick your tongue out for me, and then raise it up and down, and then side to side. Perfect. Patient has full range of motion of the tongue. I'm now going to assess the patient's facial nerve, cranial nerve of 7. So if you could please wrinkle your forehead for me, and then frown. Could you smile? Could you raise your eyebrows? Could you smile with teeth? Could you puff out your lips? And could you purse your lips? And then whistle for me. Okay. Cranial nerve 7 is intact. I'm now going to move on to the patient's neck. Looking, I see the trachea is midline with the body. I see the skin color is consistent with patient ethnicity, and I don't see any signs of redness or any masses. I'm now going to suspect range of motion, so if you could please lean your head back and then down, touch your chin, and then if you could rotate it around, and then your ear to your shoulders for me. Perfect. Patient has full range of motion of her neck. I'm now going to assess cranial nerve 11. If you could raise your shoulders up against resistance, and then turn your head against resistance. Good, cranial nerve 11 is intact. I'm now going to move to look at the patient's hands. I see the skin color is consistent with patient's ethnicity and her face, and the rest of her body. I'm looking at the fingers. I see there's no signs of ridges, any cracks. I don't see any signs of clubbing. I see the capillary refill is less than 2 seconds bilaterally. And I see the angle is less than 160 degrees. Testing skin turgor, I see it's elastic and returns back to shape immediately. I'm now going to assess the patient's radial pulse. I feel it's strong, regular, at about 80 beats per minute, and there's no signs of unusual moments. I'm looking at the patient's breathing. It's eupneic. There's no use of accessory muscles. Lung sounds are bilateral, and there's no signs of abnormal breathing patterns. I'm now going to assess the patient's range of motion. So if you could please get your arms like this for me. And then with your wrist, you're going to make a box. And you're going to close it all the way, and then open it out all the way. Good. And we're going to do the same with your fingers. So make a box, close it into fists, and then open it all the way. Good. Now spread your fingers out like that. Good. Now we're going to assess your fine motor control. So I just want you to close your eyes, and then touch your index finger to your nose a couple times with both hands. Good. And then open your eyes, and then you're going to touch your nose and then my finger, okay? Good. Good. And now get your fingers and just do this for me. As quick as you can. Just tap your thumb. Perfect. And then on your, just pronate and supinate on your thighs. Perfect. Patient has full fine motor control. I'm now going to assess the patient's strength. So first, I'm just going to feel this. I feel this. I don't feel any crepiness. Do you feel any pain?
No.
No. All right. So now we're going to assess strength. So pull towards you, and then push away. And then pull up. Good. And then push, one sec. Push down for me. Good. And now against resistance, you're just going to try to spread your fingers. Good. And now squeeze my fingers for me. Good. Patient's strength is bilateral. There is no weakness. And patient has 5 out of 5 strength. Now I'm going to assess the patient's cardiac landmark. So I see the AP is 2 to 1. I see there's no signs of pectus cavernosum, pectus excavatum. I see that the intercostal ridge is about 90 degrees. And I don't see any signs of barrel chest as well. Now, if you could please turn around for me. I'm just doing this because we're on a desk. Looking at the patient's back, I see the muscles development is bilaterally symmetrical. I see no evidence of adventitious breathing. And I'm going to perform the whisper test before I begin. So if you could cover your left ear for me, and then repeat what I say.
Awkward.
Perfect. Patient was able to repeat a 2-syllable word from about 2 feet away. Patient has a negative whisper test. I'm now going to be auscultating the patient's lung sounds. So starting with the apex, right here bronchial sounds, if you could please breathe in. Good. And then again. Good. Moving to the second intercostal space, breathe in. And I hear bronchovesicular sounds here, breathe in. Moving on to the fourth intercostal space, breathe in. Good. And I hear vesicular sounds here, breathe in. And then to the sixth intercostal space, breathe in. And breathe in. And then the eighth intercostal space. And then one more time. Perfect. Vesicular sounds there. No signs of adventitious breathing. Lung sounds were clear throughout. I didn't hear any crackles, rhonchi, or wheezing. If you could please hug yourself for me. Good. I'm now going to listen to the lateral sides. Starting here, if you could please breathe in. And breathe in. I'm going to pull back, breathe in. And back a little bit more, breathe in. And breathe in for me again. And breathe in. And breathe in again. Good. And then one more time. Good. Lung sounds were clear throughout. I didn't hear any signs of just breathing. I listened to 4 sides on the right and 3 on the left. All right. So if you could please turn to face me again. I'm now going to listen to the patient's anterior lung sounds, starting at the apex. Let's breathe in. I hear bronchial sounds. Breathe in again. And then moving on to the second intercostal space, breathe in. And then again, I hear bronchovesicular sounds. And then moving on to the fourth intercostal space, breathe in. And then breathe in. And then the sixth intercostal space, right here, vesicular sounds. And breathe in again. Good. Now, I'm going to assess the patient's lung sound, or cardiac landmark, so I don't see any visible pulsations. I'm going to palpate at the PMI. I don't feel any thrills. Putting my hand here, I don't feel any lifts or heaves. I'm going to be auscultating now. So just breathe normal. Don't have to do anything different. So at the aortic valve, second intercostal space, right sternal border, I hear S2 louder than S1. I don't hear any sounds of splitting. At the pulmonic valve, I hear S2 louder than S1. I don't hear any sounds of splitting. That's at the second intercostal space, left sternal border. And then at Erb's point, third intercostal space, left sternal border. I don't hear any sounds of murmurs. Then moving on to the fourth intercostal space, left sternal border, where the tricuspid valve is, I hear S1 louder than S2, and I don't hear any sounds of splitting. And then moving on to the mitral valve, which is at the fifth intercostal space, left mid-clavicular line, I hear S1 louder than S2, and I don't hear any sounds of splitting. I'm now going to switch to my bell, and I'm going to listen at the aortic valve. I don't hear S3 after S2. Moving on to the pulmonic valve, I don't hear S3 after S2. Moving on to Erb's point, I don't hear any murmurs. Moving on to the tricuspid valve, I do not hear S4 before S1. And then at the mitral valve, I don't hear S4 before S1. Good. So I'm now going to ask you if you could please lay down for me. Good. So looking at the contour of the belly, I see it's flat. I see it's bilaterally symmetrical. I don't see any signs of distension, any varicose veins, or any redness. I don't see any visible masses. I'm going to auscultate her bowel sounds now, starting with the right lower quadrant, which is below the umbilicus. I hear high-pitched gurgling every 5 to 30 seconds. In the right upper quadrant, I hear high-pitched gurgling every 5 to 30 seconds. And the left upper quadrant, I hear high-pitched gurgling every 5 to 30 seconds. And in the left lower quadrant, I hear high-pitched gurgling every 5 to 30 seconds. I didn't hear any sounds of gorgorrhythmia, and the patient's bowel sounds are clear and present. I'm now going to move on to light palpation. So tell me if anything hurts, okay? Starting in the right lower quadrant, and then in the right upper quadrant, the left upper quadrant, and the left lower quadrant. I didn't feel any masses. Did you feel any pain? No? Good. And I didn't feel an enlarged liver or spleen. I'm going to move on to deep palpation, about 2 inches in. I'm going to feel below the umbilicus for the right lower quadrant, above the umbilicus slightly for the right upper quadrant. I don't feel the liver here. And then in the left upper quadrant, I don't feel the spleen or any masses. And in the left lower quadrant, I didn't feel any masses. Did you feel any pain when I palpated? No, good. So now I'm going to move on to the patient's lower extremities. I'm going to pull the pant legs up just a little bit, if that's okay.
Yeah.
Looking at the skin, I see it's consistent with the rest of the patient's body. I see the hair is evenly distributed and bilaterally symmetrical. I'm going to feel for pitting edema. I don't see any pitting edema. The skin retracts instantly. I'm looking at the nails. I see that they're pink in color. There's no signs of ridges, any cracks. I don't see any clubbing. I see the angle is less than 160 degrees. When I press on it, I see the capillary refill is less than 2 seconds. I'm going to feel the patient's pedal pulse. I feel it strong, regular at about 2+. And feeling posterior tibial pulse, I feel it strong, regular, and about 2+. Good. So now I'm going to ask you to come to the side again. I'm going to raise the bed up just a little bit so your feet are still dangling. I'm going to test your patellar tendon reflex. So I find the kneecap and I'm going to hit just a little bit below. Good. And I see the patient had a strong reaction. I rate that at about a 2+. I'm now going to ask you to do a couple maneuvers for me. So if you could make a figure 8 with your foot. Good. And then take one foot and just bring it down the shin of your other leg. Good. And then if you could just tap your feet a little bit in the air. Good. All right. The patient has full fine motor control of her feet. So I'm going to lower the bed all the way down now. And I'm going to help the patient to stand up. If you could stand up, perfect. If you could just turn a little bit for me, I'm going to assess the patient's back. So just bend over down for me. Good. Looking at the back, I see the spine is midline with the body. I see the muscle development is bilaterally symmetrical. I see no signs of kyphosis, lordosis, or scoliosis. And you can please stand up. I'm going to assess the range of motion of your spine now. So we're going to lean forward again, and then back all the way as far as you can. Good. And then side to side. Good. And then just do a rotating motion with your spine if you can. Good. Patient has full range of motion of her spine. So now I'm going to assess your balance. So just keep your feet together, your arms close to your sides, and then close your eyes. And while I do this, I'm doing this for 30 seconds. I see the patient is able to maintain proper balance and has a negative Romberg test. You can open your eyes now. All right. So keep like this. And I just want you to get on one foot for me. And then hop a couple times. Good. All right, and you can put your foot back down. All right, the patient is able to maintain fine balance and maintain proper proprioception and has good cerebellar function. Now we're going to look at this wall over here, and I'm just going to ask you to walk normally there. And then on your way back, walk heel to toe for me. While I do this, I see the patient's able to maintain balance while walking. I see she has naturally bilaterally opposing arm swing when she walks, and there's no signs of an unusual gait. There's no unusual limp. I'm gonna help you to sit back down now. I'm gonna make sure the bed is in the lowest position. I'm gonna get the side rails up. I'm gonna make sure you're comfortable, so just have at it. And if you need anything, pressure call it. I'm gonna talk to your doctor about your results, okay?
Okay.
I'll be in a little bit. I'm gonna do hand hygiene as I leave. I'm gonna gather my supplies. Would you like the curtain open or closed?
Keep it closed.
Keep it closed, all right.
Yes.
And done.